the United States will ramp up its response to the Ebola crisis in West Africa with plans to build 17 treatment centers, train thousands of healthcare workers, and establish a military control center for coordination, U.S. officials said. Obama is responding to requests from the United Nations and World Health Organization to increase the U.S. role. The goal is to slow and then halt the epidemic before it spreads further, or possibly mutates to become even more dangerous, the officials said. President Obama is expected to announce the assigning of up to 3,000 military personnel to combat the Ebola virus in West Africa Tuesday, while the Pentagon has requested Congress to divert $500 million in overseas contingency funds in support of the effort. The fight against Ebola is considered, in part, a national security issue, because the disease threatens fragile governments in Africa, and could lead to more safe havens for terrorists. The request falls under the jurisdiction of the Pentagon, because the military has the capacity to set up quarantine camps. The WHO estimates that the hardest-hit countries, Guinea, Liberia and Sierra Leone, need at least 3 to 4 times the number of medical and public health workers currently on the ground, or another 600 doctors to care for patients and 1,000 workers to track their contacts. The U.S. is stepping up its response, as African health and aid workers are dying after contracting the virus or fleeing the region. There are no approved drugs to treat Ebola. The death toll in the Ebola outbreak is expected to reach 10,000 before 6 months from now, and some estimates believe it will reach 500,000 before it's over. Ebola is spread through direct contact with the bodily fluids of sick patients, making doctors and nurses especially vulnerable to contracting the virus that has no vaccine or approved treatment. While declining to discuss the plan in detail, White House spokesman Josh Earnest said Obama believes that making an investment here early is critical to trying to snuff out this problem before it becomes a much more widespread problem.